Welcome to Dog Friendly Dog Health Podcast with Dr. Sophie Bell, myself, James Waters, and Steve Bennett, founder of dogfriendly.co.uk and Dog Friendly Magazine.
The Doggy Podcast with Steve and James.
Today, we are discussing our first dog health topic, successful senior dog care, or how to help your dogs as they get older. Steve, you've had a few dogs which have crossed over the rainbow bridge over the years. Tell us about some of the challenges you've seen in your dogs as they've got older.
We've seen lots of different symptoms of growing old. Billy, Saluki, that I mentioned in previous podcasts, he really did suffer with joints, probably because of the broken bones that he had when he was rescued. But he benefited from a number of things that I'm sure Sophie will talk about. Not only drugs, but other treatment as well. I've also had two retired greyhounds, and one of them was an ex-racing greyhound, and she had obviously had some issues in her life, and old age didn't help those issues. So I'm really looking forward to hearing from Sophie, and I've got a couple of questions I'd like to ask as well.
Our Stanley is only coming up to 6, I think, so we haven't sort of got to that at the moment. And obviously, parents had dogs that I saw there was challenges, but yeah, it'd be great to listen to Sophie. Sophie has worked as a qualified vet for 12 years. After realising that owners were not armed with the everyday life-saving knowledge that would hugely benefit them and their dogs, she created Animal Love, a teaching platform offering owners and pet professionals courses in health, well-being and first aid alongside educational webinars to help pet owners deal with a variety of situations. Sophie has spoken at many events and on radio and has even featured on the BBC programme Inside Out. She was also a finalist in our Dog Friendly Awards last year with her business Animal Love. We'll talk about that a bit later. So, hello Sophie, do you want to add to that introduction?
Hello. Oh, what would you like me to add? I mean, that was a great introduction and explained what I do really well in a nutshell. Animal Love is a huge platform of learning possibilities for people, and it grows all the time. It's my way of trying to take my veterinary knowledge and my hands-on knowledge and give it to other people, because in a veterinary consult, we don't have time to give people the ins and outs of the problem they're facing. So that was the idea behind it. And hopefully it has been helping people for, well, now probably around 7 years. So quite a long time.
It's quite a brave step then, because you're still practicing as a vet and you started this business. So what was the instigator to get that going?
So funny enough, it was a work-life balance. I thought that my life might be, I might have more time, but actually I now have less. That was the original plan. No, actually, I'd started teaching pet first aid, say around about 7 years ago. And it wasn't until coming up, probably 5.5 years that I started to do things online. The main drive was I had a 1-year-old, then gave birth to twins, and life was incredibly hectic. And I was trying to think to myself, how on earth do you create a living in this scenario? And so I, initially started thinking, well, I want to be able to go out and teach all of these things, but I can't, because I can't work as a vet. I can't raise 3 new babies, and I can't, try to teach at the same time. So then I brought it online, and it was the best thing I did, because actually a lot of people, for one reason or another, don't like to attend classroom-based courses. I still do classroom courses. And for some people, they feel very anxious in groups. So that was actually a driving factor to also get my content online in video format, so people could learn at their own pace and within a relaxed environment.
Yes, it sounds really good, a real solution, but hasn't worked out necessarily to give you less work. So you still do quite a lot. You're real sort of hands-on vet still. And I noticed we talked about you before about going abroad and helping out with neutering. Tell us a little bit about that.
Yeah, that's the irony, isn't it? That I do, even in my spare time, in my so-called holiday time, I go and I try to sort of dedicate some time volunteering, and whether that be in the UK or abroad. So my last session was in Cape Verde for a charity called OSPA, and I worked out there some neutering, but also treating a lot of the street dogs that had different ailments and illnesses. And it was really rewarding and, a very great experience. And I actually hope to go again this year, because there was a lot that I achieved in that 2 weeks. Of Of course, I have to run it past my partner because he's the one that then gets left with 3 small children every time, but seems very happy about it. I think he knows it. It often sends me home in a different frame of mind. I think once I've done charity work, I feel really keen to share more knowledge and really upbeat because I've done something that I feel that I've rewarded it's a reward for myself, believe it or not, to work in a situation like that. So it's great. And I have a friend actually that's just starting a rescue in Serbia. So I'm hoping that perhaps at some point I'm going to be able to get over there as well and start helping her with some of the treatments. So it's mainly time. If I had the time, I'd be volunteering all day, every day. But again, it's trying to schedule in at least a month of the year that I can actually give back some time to charity.
James mentioned in the introduction that you were a finalist in the Dog Friendly Awards for the most dog friendly vet or wellbeing service. And how did you get involved with that, and what feedback did you get from your customers?
Do you know, actually, this is how I lead my life in a lot of ways. First of all, I didn't realise until a little later into down the line that I was actually up for an award, and I couldn't believe it. And I'd already realised, oh my gosh, all these people have nominated me and my business, and have written such amazing feedback. And I have to say, what that did for me was, again, keep me going, because sometimes, like everybody, I'm exhausted. I'm so overwhelmed sometimes with working in clinic. I'm constantly answering people's emails to help them with their pets, to giving them ideas to help with their well-being. I'm constantly creating new content. And sometimes I sit there and I think, is anyone listening? Does anybody actually enjoy what I do? Now, of course, I know they do because people attend webinars and things, but sometimes you get a bit, I'm not sure. So actually, for me, it was huge reassurance that what I'm doing is actually helping people's pets. It's helping them, and it's helping pet professionals. I had a lovely email this morning from someone saying that they are a dog boarder and their inspector came out and looked at all the learning that she had done, predominantly with myself, and couldn't believe the level that she was learning too, and the fact that she was learning all of this extra knowledge to help those that she looked after. And that's so rewarding for me. It gives me I give myself a pat on the back in those scenarios. So that really reiterated it. The awards really did make me realize that actually what I'm doing is very much appreciated, and I don't need to be thanked. It's just a way of me realizing that actually I am being thanked, which is amazing.
Yeah, and it was good because when we asked for some pictures or a video, I think you sent us a video from when you were in Cape Verde, didn't you?
Yeah, I did.
So you couldn't make the award as well, but it was, you were there on the ground doing the activity that you enjoy and helps your knowledge and everything. So
I did, and so it was a fantastic experience. And when you go abroad, actually, you see lots of different diseases that we don't see here in the UK. So for me, it's almost like going back to vet school again, because I have to revise all of those things that we perhaps learn at vet school, but we don't really encounter in the UK. So for me, it's almost like a new learning curve too. So that was really great.
You've done a feature in the magazine about senior dogs. Before we talk about that a little bit further, is there one top vet tip you would give to dog owners to keep their dogs healthy, almost throughout their life?
Keep their weight down. I see so many fat dogs, and I know that we're all, I'm not going to lie, I've got 3 dogs, and one of them has a nickname Fat Alan because unfortunately he's quite chubby. Now the other 2 dogs, Jelly and Huey, are nice and slim, and I have realised that poor old Alan, he is absolutely brilliant at hiding under the sofa when the kids are eating something, and they're off to eat something and think that they've finished their sandwich and realise actually it was Alan, he pinched it and ran off and ate it. So we've discovered that now, and Alan is on a very strict diet and he's being very strictly monitored. But I see so many overweight dogs, and the impact that has on their health long term is huge. And I think, there's 2 things actually. I would say one is the weight, and that is incredibly important. Once we start, I'll give you an example of how profound weight loss is in dogs that are suffering with joint pain, for example, whether it be arthritis or, an early joint disease. Losing weight is as profound as giving a painkiller. So that means that it might be that we can lower pain relieving drugs for these dogs, which is incredible. No one wants their dog on painkillers long term. And of course, some dogs are developing arthritis from the age of 1. So weight is very, very important. And the other thing is dental care. So, I don't think people realize how much of an impact dirty mouths have on the body. For example, dogs with poor dental health are so much more likely to develop kidney disease. And kidney disease is not reversible. It's there. Chronic kidney disease is there for life. And you can't do anything about it at that point. So I would say that the two things you should be monitoring all the time is your dog's weight and your dog's mouth. And if you focus on those two things, I honestly believe you will have a much happier and healthier dog.
This is fascinating. Is it not just the food? Is it that people aren't exercising their dogs enough?
So no, actually, believe it or not, exercise only accounts for 5% of weight loss. So when you're on a weight loss program as well with a dog, exercise, of course, is incredibly important, absolutely, for so many reasons. Yes, it will keep them fit and healthy, and it's good for heart health, it's good for brain health, all of those things. And of course, it will have some impact on the weight, but it's not the mainstay of things. So often people will come to the clinic, I'll tell them that, we really need to work. And I'm very nice at wording it. So look, we'll work together. Let's just get some weight off, okay? And you'll really notice a difference in your dog's energy levels and everything. And they'll say to me, well, I know what I'll do. I'll double the walk. And I'll say to them, well, it's not the way forward, because some of these overweight dogs, actually it becomes painful to walk. And so increasing the exercise is not the answer.
Okay.
It's looking at calorie intake. And that sort of things that I teach on courses. That's a prime example of something I would teach somebody. How do you work out how many calories your dog should actually have? And what does that mean in terms of how much food they can actually have? If you stick to that, you will be absolutely winning.
So in your day-to-day work, Sophie, how much of your time is spent on senior dogs?
So that's a good question. I say, first of all, okay, I have two passions in my veterinary life. And one is neutering, not because I think everything needs to be neutered, because I find it a fascinating topic to study, because there's so many new things coming through as to why we should or why we shouldn't. And senior dogs are my absolute passion. And I would say on average, probably about a quarter of the dogs that I see on average are elderly dogs. And sometimes I think there's just a key message for people that, remember, they are old. And I think what happens is people just treat a dog as it is from when they get it into their care the same way throughout their life. And the bottom line is they can't do those, you wouldn't do that with a person. As a person ages, we have to adapt things to make it better for them. And that's exactly the same with a dog. And just, it can be simple adaptations can make a huge world of difference to a senior dog.
So are there a few very common problems that older dogs suffer from?
I think now, if I look at what I've seen a lot of recently, is cases of dementia, dogs developing dementia. And people, actually, it's funny, I find people a bit embarrassed, because they often come and they start to tell me symptoms. Then as they're telling me symptoms, I know in my mind that this dog has dementia. And they almost, when I tell them that sounds like dementia, they almost think that is not a diagnosis that we would make. So I think they're embarrassed because they think that doggy dementia isn't really a thing. So to come to the vet and say, I think my dog's got dementia, they think that it's weird to say that out loud. I get that a lot when I say to them, oh no, it is. It's a clinical disease. Like, it's a thing that we do see in dogs that makes them feel better in some ways, because they think, oh, okay, well, I'm not just sort of making up these symptoms and I'm not just comparing them to a person. Dementia's huge. And, as the dog ages, and obviously when we talk about age, we've got to think about size of dog. So, 6-year-old St. Bernard is an old dog. 6-year-old Chihuahua is in the prime of its life. It's not anywhere near being old. So it is a case of thinking of the size of the dog and then looking at how old it is. And that will give you an indication as to where they are in their lifespan. And in those senior years, you are going to see mental changes, and you can do things to alleviate those. But often it's a good thing to start early in life. So, for example, fatty acids, omega-3 and 6 fatty acids. Oh my gosh, they're incredible for the brain. And people only think of those things when a dog has joint disease, for example, because it can help the joints. But fatty acids will help so many aspects of the body, including the brain. And my advice to every dog owner is that you start them early in life. Get them on board now. They're there to protect. They're not necessarily there to only use when a dog has a problem. So I think it's a fantastic thing to start looking into doing from a young age to help them age better.
And what about arthritic pain? That seems quite a common thing that dogs can suffer from as they get older.
It is. And you say from when they get older, they're now, I can't remember the last statistic on this. It was something around quarter of dogs from the age of 1 actually have arthritic pain. It was high. And, that's quite alarming in its own right. Arthritis is very common. And
Why is that though, Sophie? Why are they getting arthritis so early?
we go back to the weight thing again, actually, that if they gain weight very early in life, as young dogs, then that definitely puts a lot of stress on the body and increases the risk of arthritis like tenfold. So that's why it's important to keep that weight gain steady and not let them get out of control. And I think as well, I guess sometimes it will be to do with the type of exercise. Well, I guess people will, and I'm not talking about when they're young, actually now there's many studies to say that when they're very young, we're not limiting exercise to say 5 minutes per month, which was the old rule that was out, but we're doing appropriate exercise. So it can be longer than that, but it's appropriate. So we're not doing things like agility and making them jump jumps when they're 5 months old. We're trying to avoid stairs, and that has a huge impact on the joints as they get older. Anything that has quite I guess puts something on their sort of shock absorbers, so even jumping in and out of the boot of the car, going up and down stairs, things that we do every day, over time those shock absorbers in their body start to wear, and then we start to get a lot of arthritic changes where the body tries to compensate and improve the way the dog moves, and so they start to build like new bone, and we have bony growths and things and then that becomes painful. So it's about just being vigilant from a young age. You can't avoid it completely, of course. I get lovely slim dogs that have someone's thought very carefully about how they exercise and where they exercise and what they do, kept the weight down, and they've still got arthritis. So some of it will be genetic as well.
So what is the general treatment then for symptoms of arthritis?
So arthritis, basically, there's loads of things that owners can do, for example. So if you've got slippery floors at home, the dog will often find it hard to get up when they're arthritic. So popping down yoga mats, the areas where they're using a lot and getting up and walking on a lot, making sure they keep the nails short so that they're not affecting weight bearing, because overlong nails will actually make it harder for the dog to be able to weight bear properly. So it's two things straight away that the owner can focus on. The other thing they can look at is using a warm compress. So we just use, obviously you don't want to make it boiling hot, but you take something like a hot water bottle, wrap it in a towel so it's not burning hot, apply that to arthritic areas for 10 minutes in the morning before they get up. So nice to do that for senior dogs, especially because it actually relaxes the muscles and helps them when they're feeling a bit stiff after they've been sleeping. Adding in joint supplements is hugely important. And I mentioned essential fatty acids, omega-3 and 6. There's lots of other supplements out there, but certainly they are the main player in helping with inflammation and just helping with the joints in general. The vet will probably end up prescribing some anti-inflammatories. They might prescribe a whole array of other pain-killing drugs, but of course, owners can also reach out to things like physiotherapists, hydrotherapists. I have a veterinary friend who does a lot of laser therapy and acupuncture therapy. There's so many of these things, as long as you are using reputable people, and often your own vet is asked to fill out a form anyway before you attend them. And remembering, if you've got insurance for a dog, quite a lot of the time, actually, insurance policies cover these complementary therapies. So an arthritic dog, you need to invest time, and you need to realize that you've got to change things around the house to make things better. You've got to add in supplements, and you've got to look at a whole array of therapies along with then using painkillers. And honestly, I had a spaniel that developed arthritis at age 2. We got to around about age 9 before he really needed to go on to more heavy duty drugs, because I managed it in all of those ways.
That sounds good. Lots of advice on arthritis for dogs. And what about things like dogs losing their sight a little bit and possibly their hearing? Are there things that you can do generally without getting them doggy hearing aids, for instance?
I know, wouldn't that be sweet? Or a pair of glasses.
I don't think they'd stay on, to be fair.
No. So a couple of things. There's a few things that happen with senior dogs with their eyes. One of them, it can get changes to their retina, and what that often means is on a bright sunny day like today, would you believe it? There's not been any nice weather at all, but finally we see the sun. They might find that a bit challenging when the light is bright. Some of those dogs, you might notice, sort of look at the ground and don't perhaps look forward. So that's something to just take note of, because it might be that you find that they are uncomfortable in bright light. And actually, we say about glasses, there really are goggles that dogs can wear in brighter light if they're struggling with the light. So, look at how they are acting out when they're outside, then they often lose their night vision. So they don't have, so when I say night vision, it's not they have some sort of superpower. It's just that when the light becomes dim, dogs can tend to see quite well in comparison to us. But when they get older, that vision drops substantially. And so when there is just low level lighting that perhaps we can see in, they then might not be able to see hardly anything at all. And that's very distressing. So they could pace all night, not be settled because they've suddenly been submerged into darkness where they can't visualize anything around them. And then you said about their hearing, absolutely. So again, as they age, they lose their higher pitch tone of hearing. So usually when we communicate with dogs, a lot of us, I think, do put on the baby voice or speak higher and we're like, good boy, it's okay. You know, we sort of talk like that. Those older dogs would appreciate it if you deepened your voice. And, you know, good boy, I don't quite do a good deep voice, but, you know, try and speak lower. I mean, I do think there is some selective hearing. As I say it every time, they can hear the fridge, you know, they're 10 feet down the garden, the fridge door goes, they come running up, but yet they can't hear you when you give them some sort of, you know, command. So I do think they become selective. So yeah, it's just about being vigilant. And I think, you know, you can put so many things in place, but you have to look at all the senses and all the things. I mean, the other thing, of course, as well, I do find that dogs, as they age as well, they start to develop quite dry and crustier noses. That has no impact on health. You know, it doesn't matter if a dog's nose is dry or wet. It's an old myth. But the thing with this sort of more drier crustiness to the nose, it might get a bit more sore. So sometimes they end up needing balm applied to their nose as well. And that's often because young dogs lick their nose more often to enhance smell. Old dogs, I swear it's that attitude of, oh, I've been there, I've done that, I smelt that, you know, oh, I can't really be bothered. And so it tends to be that older dogs tend to seem to have drier noses as well. So it's another thing to sort of look out for and realize their sense of smell might not be as acute as it was when they were younger.
Yes, I think Steve and I have both got dry noses these days as well.
That's because we don't lick them anymore, yeah? Sophie, is there a way we can check how health fit our dogs are as they get older? We've got a rescue whippet who's 15 years old now, bless her. And how do we find out just how fit she is?
Do you know, and this isn't from because, you know, I don't own a clinic. I don't, you know, benefit financially for people paying out in veterinary practices. But I would say, and honestly, I've done this with my own dogs throughout, actually. I think one thing that is worth doing, if you can afford to do it once a year, great. But even if you can just do it, you know, whenever you can, one thing I think is great is just what we call like a senior profile test. So take a drop of blood and first of all look at what's going on internally. Will be a great way to see if there's anything brewing, anything there that's, you know, kidneys, are they slightly struggling? Because then we can make changes around the diet, we can make changes that will make them work better or last longer, so to speak. I think as well, you know, you're looking for how well they move, how well they interact, things like dementia. Certainly if you've got that going on, usually it worsens at night. They start to pace. They often will stand at the wrong side of the door. So they've always known which way it opens, but now they stand at the other end rather than the handle end because they've forgotten, and they get themselves stuck in places as well where they stand maybe under a chair and then think, actually, how do I get out from here? So spotting things like that and trying to intervene, because, you know, that confusion can feel quite horrible for them. And I think it's just general, you know, the general things as well that you often get asked. Are they eating? Are they drinking? Drinking's a great one, actually. Drinking should be pretty stable in our dogs. They are very, very thirst driven. They know when they need to drink, unlike cats that spend their life dehydrated, I swear. But dogs, they know when they need to drink, and they drink what they need to drink. Now, when the body gets out of kilter for something like, say, kidney disease, they excessively drink, or diabetes, they excessively drink. And that's a good one to monitor. If you start thinking, hang on, you seem very thirsty, or maybe they're urinating in the house because they're drinking so much, it's an alarm for you to say, oh, has something changed internally? So that's something else I would say, monitoring thirst and monitoring weight, both ways. You know, is it going up? Is it going down? Mentioned a couple of old dog diseases, things like Cushing's disease. Body makes too much steroid, they get enlargement of certain organs like the liver and the spleen, and now they look like they've got a big fat pot belly. That's not weight gain, that's the organs getting big, but that shouldn't happen. So looking at the body and seeing if it changes, And equally, if they become diabetic, they become skinny. So it's about looking at them overall. How are you moving? Are you drinking the same, eating the same? What's your demeanor like? And piecing it all together. And of course, you can go one step further. If you go and you learn Pet First Aid course or any other health related webinars, a lot of, all the ones that I teach, and teach you how to clinically exam, what's the pulse rate doing? What's the gum color supposed to look like? And these are things that might change if there's a problem.
That's interesting, because I was thinking about the stats that they take for people as you go to the doctors. Straight away they start pumping your arm and taking your temperature. So there are some things, and as you say, you could learn them from doing a first aid course or something in dogs.
Yes, you could. Fortunately, we don't have our temperature taken the same way as dogs, which is great. But actually, we do, because one way you can take a dog's temperature, you can use a human ear thermometer. Works the same as it does in our ears. So, again, I teach all these little tips and tricks where you haven't got to think to yourself, oh gosh, I wouldn't want to do that to my dog, because a lot of what I teach you is visualizing and understanding subtle changes, like why are the gums looking a different color? Why is there why is there some bruising on my dog's belly? Things that shouldn't be there, that perhaps you don't know how serious that can actually be. And I think people delay treatment sometimes because they don't understand that what's in front of them is actually really bad, but they don't realize that because the dog's acting normal, because dogs are amazing. They compensate through the worst of things.
Sophie, I've had dogs for, the last 20, 25 years. And because a lot of them were rescue dogs because of Lynn's involvement with a number of rescue centres, we've lost a number of them. So they've died. And it's incredibly emotional when that happens. And I think certainly I'm quite a selfish dog owner, because I want my dogs to stay with me as long as they possibly can. Is there a point? And if there is, do you have an opinion on when actually we shouldn't put our dogs through treatment because it's just too much for them at their age?
Yeah, I think, first of all, you said you're a selfish dog owner. No, you're not. You're just a normal dog owner. I don't think any of us want our pets to go. I remember when my dogs have aged, I've started to get really anxious about it months before, even if there's nothing wrong with them. I just see them getting older and I start to think, oh my gosh, it's going to come that day. Yeah, I think there is that cliche, it's better a day too early than a day too late. And that is incredibly true. I think adding to that, actually, which would be very helpful for people, I have a free webinar on my website called How and When to Say Goodbye. And in there, I actually have a pet bereavement counsellor come speak as well. And it's about some charts. So I give some physical things that you can tick off. So looking at quality of life and being honest and ticking boxes. It is a box ticking exercise where you sit down and you make yourself really think about the questions in front of you and answer honestly. And it helps guide. And so many people have commented that really helped me to know that actually, I think I was fooling myself thinking that I thought my dog had a good quality of life. Once I did that, I realized that actually they didn't, and I was doing this more for me. So I give lots of advice on that, and that's really helpful for people. I say, and feedback from that has been, it's guided me completely. And you're not abnormal for being selfish though, because nobody wants to face that. The only thing I would say is some comments I do get from people, which I find stressful because I have to try to tell them when they're at their deepest, most upset time anyway, is that they'll often say, I think I'll just let them die naturally. I've got perhaps presented with a dog that is really sick and their view is, well, he should just pass away. It's a bit like, not trying to compare dogs with people, but it's like palliative care with people, and which we do with dogs as well, palliative care. We have the great option that we can end suffering, and that's exactly it. There comes a point where we don't have to make them feel the pain and perhaps the confusion because they can't communicate with us. We have that option. And sometimes as a vet, there's been occasions where I've driven home and just cried my eyes out over a euthanasia because I felt that it perhaps wasn't the right thing. I've had my own view as well. And then I've also felt very relieved when people have come in and I've said, I think that's the best thing for you to do. And they've said, what would you do if it was your dog? And I'm always 100. I'm brutally honest. I would tell people exactly what I would do if it was my dog. And, when I say to them, if it was mine, I'd let them go. And when they say, I agree, I breathe that sigh of relief of thank you for not making them go through that. So it is a big topic, but I'm always happy to help people with making decisions. And you've got to make it ultimately yourself, but it is very difficult.
Okay, Sophie. So we had a question from our member, Joy Harterink, about her dog, and one of the things you mentioned early in the podcast about teeth health, she's got an older dog who unfortunately only has 7 teeth left. What food and care would you suggest to her dog?
So I think, well, firstly, Joy, I think it's great that you're asking, you're trying to find out more about dental care, because I think some people, just put it to the back of their mind. And I understand, and because I think what people always seem to think is, oh, I've got to get a toothbrush out, but you don't. I mean, obviously, if your dog could get used to a toothbrush, great. There's nothing better than mechanical action of a brush on a surface of a tooth. The key things, though, are that we are doing something, and it doesn't have to necessarily be the brush. So what we're trying to do is minimize plaque, and plaque is the soft stuff, and tartar is the hard stuff. And what we're trying to do is we're trying to stop the plaque turning into tartar. And that usually takes a couple of days for new plaque after they've eaten to form into tartar. And it's a tartar buildup that then allows bacteria to grow. So to stop the plaque forming, we can do something very simple, like use products that remove plaque. So some, there's one, and I'm not endorsing it in any way. It's just because it's got the obvious name Plaque Off, and people will use that, and often they'll say, oh, it's not working. And I think, but it is working. That's the whole point. It's stopping the plaque from sticking and forming into tartar. Yes, it's not going to make your dog's teeth clean and shiny if they're already, full of tartar, but it will prevent more tartar. So you can use various items like that. I do like dogs to be chewing appropriate things. Once you start getting into the realms of much harder products, like the sort of yak chews and perhaps bones, like obviously never cook bones. A dog with poor dental, poor dentition would not be a good choice. They'll likely probably fracture a tooth because it would be too much. So I really like, actually, for my dogs, I feed them treats that have hair on them. So like hairy rabbit's ears or rabbit's feet, because it's quite abrasive to the tooth, almost like a brushing type action. And then the most important thing is trying to use, obviously, a doggy toothpaste, not human. And there's various ones out there, and I usually say you're looking for products on the back such as chlorhexidine that you want in the toothpaste, or perhaps you want an enzymatic toothpaste. You don't need to use a brush. You simply just somehow introduce it into your dog's mouth. If you can sweep it across their gums or their teeth with your finger, their tongue will move the paste all around the mouth. It will stick around for about 20 minutes doing its job. They'll swallow it. Job done. It's as simple as that. You don't have to be taking out a brush every time. If you can, you're going to be doing an even better job. But if you can't, at least do the paste at the very minimum every other day. Introduce good treats to give, lots of chewing, and using other products that will remove plaque, and that will make a huge difference.
Great. That's lots of tips for doggy teeth there. Just you mentioned about don't use human toothpaste. And the reason for this is
human toothpaste contains a lot of different chemicals, but quite a lot of the time, people have probably heard of this toxin before called xylitol. And xylitol is found in a lot of sugar-free products, but also a lot of dental health products, because it's deemed as really good for our teeth, actually. It's in a lot of human mouthwashes and human toothpastes. And it's incredibly toxic to dogs, like very toxic to dogs. So this is the reason why we just avoid it. And of course, sometimes they have other things in them that are not particularly great for dogs, but it's the xylitol that's the really dangerous part.
So thank you for coming today, Sophie. I think we've learned a huge amount, a wealth of information about dogs, and particularly senior dogs. It's been great. Have you got any plans for traveling and helping out in places like Cape Verde soon, or?
Yeah, I'd probably try and go. I usually try to go towards the end of the year. I have been looking at as well something I'd love to do, but again, it's the time, because obviously having the young children and can't always desert my partner and say to him, there you go, they're there again. And obviously I want to spend time with them too. But the one thing I really would like to do is, I have seen a position to be able to go out and help some of the students in India, actual vet students, with teaching them surgery. And it's another sort of thing. So it's not the direct hands-on, this is a different approach, I guess. So I really love being amongst the dogs. I'm not going to lie, it absolutely fulfills my day. I can't think of anything better, especially when they just need that TLC. But I also feel like I enjoy teaching, and I would really like to give more back to perhaps, students in other countries, that perhaps not saying that the teaching is in any way, less than what we do here in the UK in veterinary, but we do have a high standard in the UK. And I think I'd really like to take some of that knowledge that we use here to students in some other countries, like India, and give them a bit more help with their surgery for when they qualify. So that's kind of my plan. And of course, always working on new content. I never stop. When I qualified as a vet, I had this plan in my mind that I would be constantly doing surgery. That was going to be me. I was never going to do anything else but be in the operating theatre. And one thing I was never going to do is be that geeky vet, the one that loves to sort of learn about new things all of the time. And that's the person I've become. I never stopped doing CPD. I never stopped reading, learning all these new things. And it's absolutely fascinating. So I spend a lot of time reading and learning about all new techniques. So that's kind of what the year holds for me, along with my usual emergency night work and day work. And so, yeah, it's going to be a busy few months, I think.
Sophie, where do our listeners find out more about, animal love?
You can find me on my website, which is www.animallovepetfirstaid.co.uk. And on there, I've got free content too. I've got a lovely free webinar coming up in September called Designing a Pet First Aid Kit. I do try to give something back. I don't expect you always to come and have to invest in knowledge. There's free content. I've got, various videos showing you how to do things. So, pop along and have a little look. And then you'll probably find something on there that maybe something that you've been waiting for. For example, I've got a new course coming out all about diabetic dogs, how you manage them. If you've got a diabetic dog, honestly, I'll change your whole view on how you manage your diabetic dog and hopefully make a huge impact on their health. So certainly reach out to me via the website, as I think many people are these days. I'm on Facebook under Animal Love Pet First Aid again. And equally, I'm often sharing hints and tips and bits and bobs and trying to guide you in the right direction. And often when I find out something new myself, I'm so excited to share it, something different, something unusual. And, that is me as well. I do like to look at things from a whole different perspective. So I'm not just drugs. I like to look at complementary therapies as well. And I like to hear people's tales of things that they've perhaps done for their dog that's been really helpful, because I can research that and share it with others. So even if you just come to the website to contact me, to tell me a story about something or ask me a question about something with your dog, I'm more than happy. That's my whole ethos. My whole point is I'm there to help your pet.
Sophie, it's been great listening to you today. Thank you for being on Dog Friendly Podcast, and hopefully we can get you back in the future to talk more about tips and helping dogs at various ages of their life.
That would be great. Thank you. I've enjoyed it. Thank you very much, guys.
Thank you, Sophie.
Thank you.
Thank you, Sophie.
You can find out more about Dog Friendly Magazine at www.dogfriendly.co.uk.